Okay, I am here with Linda. She is one of Dr. Jaramillo's patients. And Linda, if you can just tell us basically the reason you came to see Dr. Jaramillo, maybe how long ago it was, what kind of pain you were having.
Alright. I was having bone spurs, what I thought was a bone spur on back of my right foot, and the pain level was about 8.5, and I had it for almost 2 years and just kept getting worse and worse and worse. So I was down here in Florida as a snowbird, and I thought, okay, I've got to find somebody.
Right.
And I just went into the telephone book and, looked at recommendations, and Winter Haven was where I wanted to have all my medical done,
Right.
so that's how she came into it. And great place. The staff out here is so open, and they recognize you when you walk in. They call you by your name, and they remember you from when you
Right.
left and came back. And so I was impressed with that, and we tried some different treatments for my foot. Started off with creams, helped a little bit for the swelling, but didn't take away the main cause of it. I got put in a boot, and basically was wearing a boot and told I couldn't walk because they were afraid that Achilles tendon would tear, and did not want that to happen. And then we tried laser therapy. That did help. I was able to get out and move about, but I still had to be in a boot. I was in that boot for almost 2 years trying different things.
Right.
And then she suggested stem cell injection, and I did do that, and within a couple days, I had to wear the boot for a week because of coming back and seeing her again. But once I got out of the boot, I haven't been back in. I worked all summer. I was on my feet. I can go for walks.
Wow.
Walk on the beach, which used to be hard in the sand. I'm fully functional with zero pain.
Wow, that's great. So, and when this was sometime in January of this year that you had the stem
that
cell
I
done?
had the stem cell.
Roughly, okay.
January, February.
So you're 11 months later, and you can pretty much resume
yeah.
all activity.
Oh yeah.
No pain.
That I was pain free within a week and a half, maybe.
Wow, that's great.
Yeah, and it just kept getting better and better until I forget that I even had it.
Wow, that's great. So I mean, like you said, you did say that she tried the laser and creams and all that. None of that worked. I mean, it worked a little bit, alleviated the pain, but did you actually think in the back of your mind, like, well, I might have to have surgery? There's nothing else?
Oh, definitely. When I came in here for the first time, I was fully anticipating that I was heading for surgery.
Right.
That there was nothing that could be done other than go in for surgery.
And then come January of this year, you come in, she talked about the stem cell with you, and you had heard about it before, you'd done research on it. And then, excuse me, you got out that day?
Oh yeah, I mean, it was an office
Yeah,
visit. I mean, I wasn't even anticipating getting the surgery,
the stem cell, right?
The injection. In fact, we were seeing her for my husband's surgery, and then she mentioned this and ended up doing it. I think we had to go back because she had to get the stem cells there, and she talked about it, and we went away and came back for another appointment, and it was just a matter of her, rubbing the disinfectant on there and putting a shot in there, and
wow, great.
It was not comfortable.
Right, of course, yeah.
But
it's better than surgery, however long you would be out.
Yeah, you bet.
Well, great. So, I mean, of course, you'd probably recommend patients that have Achilles tendinitis coming in, trying the treatments because everybody's different, trying the cream, trying the laser, and if that doesn't work, and of course nobody wants to have surgery, you probably would recommend the stem cells, right?
Oh, definitely, because I did have success with the laser,
Mm-hmm.
and I did have some success with the lotions, but not as much. The laser, I could see that working for a lot of people.
It does, yeah.
Because I was able to go out and walk right away after I had that laser therapy, and so I went through a series of treatments for that, and it did help.
Great.
But it only took me down to maybe a 3 on the pain level.
Right,
so
yeah,
it never, the pain never went away totally. But like I said, I'm totally pain-free right now.
Well, good. Well, congratulations. We're happy, and I know Dr. Jaramillo is happy and wants us to do this, so we appreciate it. Thank you very much.
You're welcome.